Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about the borderline personality disorder. It's one of 10 recognized personality disorders. It's extremely common. These people have emotionally unstable personalities, have a long pattern of abnormal behavior, unstable relationships with other people. They have unstable emotions and they have unstable sense of themselves. It's a very common personality disorder. It's estimated as many as 14 million people suffer from it, 1 to 2% of the general population at any given time. Over the course of a lifetime, however, it's about 6%, with women being slightly more commonly affected than men. Once upon a time, this was considered part of the bipolar disorder. The editor of Biological Psychiatry says that these people are set up by their brains to have stormy and emotional, although not necessarily unproductive lives. The diagnosis is based on the presence of symptoms. There is no firm diagnosis that we can get from a laboratory test or an X-ray. The key features are intense mood swings. The mood can change in minutes to hours, unlike in the bipolar disorder, where it changes over the course of weeks to months. And the mood changes in response to changes in the environment, either positive or negative events, can change a person's mood. Not so with the bipolar disorder. These people have a marked, disturbed sense of identity. They take extreme joy and gratitude at the perceived expression of some kindness, but they also show intense sadness and anger at even a perceived criticism or even a slight. They have a shift in feelings about other people. They go from admiration and love to anger and dislike after a minor disappointment, at the threat maybe of losing somebody or at the perceived loss of esteem in the eyes of somebody that they value. And obviously this undermines the relationships with family and friends and co-workers. These people have a marked sensitivity to rejection or criticism. They feel like they're victimized. They have a frantic, or demonstrate a frantic effort to avoid either real or imagined abandonment, which leads to problems in their dating relationships. They often develop new relationships to guard against the future loss of the current relationship. They excessively hold on to others. They reject others before they can be rejected. They have intense and uncontrolled emotional reactions that seem way out of proportion to the event or the situation. They have inappropriate, intense anger, uncontrollable anger and rage. And obviously that again leads to chaotic relationships with other individuals. But yet they have an intense desire for intimacy. But on the other hand, of course, they're insecure and they're ambivalent. They view the world as a dangerous and a harmful place. They suffer from impulsivity. They often engage in dangerous activities like spending or substance abuse, alcohol abuse, reckless driving, binge eating. They have indiscriminate sexual relationships often with multiple partners. There's self-injury. They leave jobs or relationships. They may run away. They have conflicts in the romantic relationships that I mentioned a moment ago. They frequently have unprotected sex, leads to unwanted pregnancies and often abuse in the relationships. Frequently, there's some degree of self-harm. They don't necessarily try to end their lives, but they harm themselves, and in their opinion, it's to feel normal. So these are the people who cut themselves on a repetitive basis. They also bruise themselves or burn themselves or bite themselves. It's a self-punishment. It's an expression of anger. It's not that they have this damaging behavior as a cry for a reaction to other people. They do this to generate what they consider to be normal feelings because they have a sense of dissociation. They don't feel like they're themselves. They don't look at themselves as individuals. They look at themselves from afar. They have a tendency to internalize anger and hurt themselves, of course, as opposed to the antisocial personality disorder. In people who have this condition, they externalize their anger and they hurt other individuals. They often express their emotions through anger and through violence. But instead, these people hurt themselves. They find difficulty in expressing their needs. But then they experience boredom and emptiness. They feel empty, or they feel like there's a loss in them. At times, it leads to suicide. And suicide is a significant problem for people who have the borderline personality disorder. It's estimated that the lifetime prevalence of suicide may be as high as 3 to 10%, with women twice as frequent as men. That's about a 50-fold, 5,000% increase versus the general society. They think that people would be better off without them. Now, frequently, men, when they commit suicide, actually have undiagnosed borderline personality. These people are manipulative. They pit one person against another. They try to keep both sides off balance to create certain conflict. They see things only as either black or white. And in intense situations, they may actually have a break with reality. They may have paranoid thoughts. In spite of all of this, these people, when you deal with them, can be very enthusiastic and idealistic and joyful and loving, but it's ephemeral. They have only occasional intense joy. But they don't have any mania. They don't have racing thoughts, and they don't have a decreased need for sleep that we see in the bipolar disorder. But these people may be overwhelmed by a variety of negative emotions, ranging from anxiety and depression and guilt and shame and worry and anger. They experience intense reactions. They have intense grief. They don't have sadness. They have shame and humiliation. They don't have mild embarrassment. They have rage, not annoyance. And they have panic, not nervousness. And these people are especially prone to dysphoria, a profound sense of unease and dissatisfaction. And they feel emotional or mental distress. They feel betrayed. They feel like they're out of control. They feel like they want to hurt themselves. So as a summary of the symptoms of the borderline personality disorder, we have severe mood that can change over hours to days, extreme anger, and problem controlling the anger, and that sets up strong up and down relationships with friends and with family. They have extreme reactions and fear of abandonment. They go to extensive degrees to avoid the abandonment. They have a rapid change in the sense of themselves, change in their goals and their behavior and their values. They feel empty. They feel disconnected with themselves. And they have a vicious cycle. And that's a problem because they have some emotional pain, and that leads to an impulsive behavior to relieve the pain. And then that leads oftentimes to shame and guilt over whatever actions they took, and that causes them to feel emotional pain because of the shame and the guilt. And then they experience stronger urges to engage in other impulsive behaviors to relieve the pain. Then we have a vicious cycle where impulsive behavior can actually become an automatic response. And they actually are aware of the intensity of the negative emotional reactions, but unfortunately they can't regulate them, so they shut themselves down, and that obviously causes a problem. And even worse yet, these individuals frequently suffer during the course of their lifetime mood disorders, other kind of psychiatric abnormalities. So they have anxiety and depression in about 75% of them, often prone to substance abuse, more than half. Post-traumatic stress disorder, attention deficit hyperactivity disorder, eating disorders, a significant number of other issues also bedevil these people. Now, the symptoms may sort of resemble superficially the premenstrual dysphoric disorder, PMDD. but that only occurs from the time of ovulation to the time of the onset of menses. These people begin their personality disorders at a relatively young age, often in adolescence or early adulthood. Symptoms may begin during childhood, but it shouldn't be diagnosed before age 18 because of the variations that occur as the brain develops during adolescence. Now, some people have stable borderline personality over the years and decades, but other people seem to move in and out of the condition, and whether that's because of them changing or us not realizing that the symptoms are still there, that can't be so easily determined. Well, if we look at who's in the clinic, it seems like women more frequently seek care than men. So that would give us the impression, the false impression, that the condition affects women more than it does in men. And women are certainly identified much more frequently, and they have the mood disorders, the eating disorders, and post-traumatic stress disorders. But in men, the condition is frequently undiagnosed, and the men don't seek care. These men often have a problem with substance abuse or alcohol abuse. They have explosive tempers. They have high level of novelty-seeking behavior. They're antisocial or passive-aggressive. Oftentimes they're narcissistic. Why is the condition existent? What causes it? Well, genetics, for a significant percentage, it's estimated that if you have a family history of the borderline personality, that your risk is about 5-fold increased. It's estimated overall that there's about a 40% genetic contribution, and whether the contribution has to do with neurotransmitters or has to do with other kind of chemicals or chromosomal abnormalities, just can't say. But the brain seems to be involved to some degree with neurobiological factors, but then your environment, the childhood environment, childhood trauma, abuse, or neglect seems to be important. There's childhood traumas like the verbal abuse or physical abuse, sexual abuse, caretaker neglect, all important and leads to unstable relationships. It's relationships early on in life with the family and the friends and the interaction with other children. And then, of course, there is your personality and temperament, the learned coping skills, all very important. And it seems that there's a neurologic pattern where people have a tendency to feel negative emotions. So it seems there's increased brain activity in the circuits that seem to be responsible for the experience of heightened emotional pain, while those brain circuits that are supposed to suppress emotional pain don't seem to be working very well. And there may be some abnormality in hypothalamic, pituitary, adrenal axis, and that has to do with controlling cortisone, so they have a heightened sensitivity to stressful events. The overall personality in personality disorder was sort of hinted at long time ago, back in the days of Hippocrates, even hundreds of years BC. In the 20s, it was thought of as an excitable personality. 1938, it was thought to be borderline between psychosis and neurosis. It was thought to be an early form or a variant of schizophrenia. But in the 1960s and 70s, they changed their mind. They said, no, it's a borderline mood disorder related to anxiety and depression. It wasn't until 1975 that it found its home in what's known as the DSM-3, the American Psychiatric Association Handbook of Psychiatric Diseases. It was given the name bipolar disorder. But the name is a bad name. It's confusing, it's unhelpful, it's stigmatizing, it's inaccurate. There's a suggestion that we need a new name for the condition, maybe call it an impulsive disorder, or an emotional dysregulation disorder, or an interpersonal regulation disorder. That would be more descriptive of what the condition is. After all, borderline personality, who knows what that means? Well, here in the United States, the borderline personality disorder is established, and it's going to stay that way most likely. On the other hand, the International Classification of Diseases that's used basically in the rest of the world considers this an emotional unstable personality disorder. That's its official name. The diagnosis is difficult. It needs a mental health professional. The criteria, as we've mentioned, are variable and they're not specific. They can be present in a variety of other conditions, and people who have the borderline personality disorder do indeed have a variety of other conditions as well. So here we have a pervasive pattern of instability. We have unstable interpersonal relationships, and we have problems with self-image, and we have problems of affect and mood and marked impulsivity. The condition begins in early adulthood, and it presents in a variety of different contexts. Well, 75% of the people who have the borderline personality disorder also at some point in time have another personality disorder to boot. So that also leads to confusion with making this particular diagnosis. So some of these people feel odd and eccentric, they have paranoid ideas. Some are overly dramatic and emotional and have unpredictable thinking that might also be present in the narcissistic personality disorder or the antisocial personality disorder. And some have a cluster of anxiousness and fearfulness and avoidance and obsessive compulsive activities. Well, the World Health Organization divides it into just two overall broad categories, impulsive and borderline. But probably a more appropriate approach was by Dr. Theodore Millen. And this doctor was a psychologist here in the United States. And he divided it into four different categories: the discouraged borderline, who had avoidant behavior and depressive activities and was loyal and humble and felt vulnerable and helpless at the same time. So we have the discouraged borderline. Then we have the petulant borderline, who is restless and stubborn and defiant, became quickly disillusioned and was resentful. And then a third form, impulsive borderline. These are the antisocial, the histrionic, the seductive, the person who was agitated when he feared or she feared loss, gloomy and irritable. And then we have the self-destructive borderline, the fourth type. So we have the discouraged borderline, the petulant borderline, we have the impulsive borderline, and the self-destructive borderline. Well, to treat people, once we can establish the diagnosis, and establishing the diagnosis, unfortunately, is kind of hard, but we need an accurate diagnosis, and we don't really have good guidelines other than those that I just mentioned. We have no blood test, no X-ray test. It's considered a very difficult to treat personality disorder. It can take years. It's hard to improve, and there are problems. There are many different kinds of problems, but not all people who have the condition really need therapy. It all depends on the severity. It depends on the manifestations. It depends on a person's age and expectations. And then, of course, there's the time involved, the motivation that the person has to go and voluntarily seek treatment on a repetitive basis, and then the ability to spend that amount of money. Well, there are a variety of psychological and psychotherapies that are available to treat the condition. The current in vogue favorite is what's known as dialectical behavioral therapy from Marcia Lenehan up in Seattle. And this just helps people access the coping skills, or their coping skills. But it seems like it only works in people who are relatively agreeable and motivated. But unfortunately, it requires a significant amount of time and effort and love and motivation, and it's time-consuming. But in the end, it could reduce by about 3/4 the suicidal self-injuries and the non-suicidal injuries. And the problem is that most people don't have access to appropriate therapy. Now, there are some internet-based therapies, some scripted meditations that you can get on the internet, and they seem to be at least somewhat helpful. there's a question about what the follow-up is. Well, a significant number of the people who undergo treatment can achieve remission, can achieve consistent relief after about 2 years. About a third of them seem to go into some degree of remission after about 2 years, about half of them after 4 years, about 2/3 after 6 years. But again, that's a significant amount of investment of time and resources into hopefully improving these individuals. Now, what about medicine? Do we have medicine for the condition? No, we don't. There are no medicines that seem to work. Medicines may be appropriate if a person has other complications or other associated diseases, mood disorder, anxiety disorder. Yes, indeed, we do have medicines for those parts of the condition, those associated manifestations. But for the underlying borderline personality disorder, unfortunately, the answer is no. So it's a difficult condition. It's an underlying personality disorder, a condition that lasts for a lifetime. Person shows difficult relationships with individuals, with impulsive activities, potentially self-destructive activities. It tends to improve and tends to worsen over time. We have a variation in the manifestations that occur over the years, sometimes some improvement and then some worsening, all depends on other stresses in the environment. And it has a problem with being appropriately diagnosed. And unfortunately, at least to date, the treatment is kind of wanting. We don't have any pills for the condition. Therapy, well, yes, indeed, therapy seems to be helpful if it's continued, but the person has to be motivated enough to continue going to see the caregiver. So there you have it. Borderline personality in a nutshell, a very difficult condition to deal with, both from the person's standpoint, those who are in the person's environment, and from the medical standpoint. But anyway, thank you for watching. I'm Dr. Ken Landau.